Welcome. My name is TIna Sikka. I'm a lecturer in media and culture at Newcastle University, and I'm really excited to introduce the series of podcasts featuring interviews with BIPOC or BAME, senior scholars, and NINE DTP studentship recipients. These conversations aim to get students from minority groups motivated and enthusiastic about applying to the NINE DTP scheme by showcasing the innovative and really interesting work being done by these academics and students. I hope you enjoy.
Hi, everyone. I would like to welcome Augustina Pemu, who is a third-year PGR student in population and health science at Newcastle University. She is a midwife, and she is looking at parental outcomes or perinatal outcomes with status asylum seekers and refugees specifically. So we're going to start out talking a little bit about your background. So would you tell me a little bit about your background in terms of your journey to academia and to getting your PhD?
My background, like you already said, I'm a nurse midwife. I'm dual qualified. I did my nursing in the United Kingdom over 10 years ago, and also did my had my midwifery qualification here in the United Kingdom. I also did a master's in public health. All these courses were around women's health, really. My public health was around women's health as well. And I have been working with the NHS for over 15 years. I became interested in pursuing a PhD when I started working as a midwife at Sunderland Royal Hospital here in Sunderland. This is because during the course of my practice as a midwife in the community, I encountered most women that had the status of asylum seekers and refugees, and they were not very happy with the outcome of their pregnancies. And when I went to visit them, I found out that most of them had some complications that could have been avoided. And they started telling me stories about their care, with their experience with the midwives, with the doctors, with the healthcare professionals in the maternity unit. I didn't just jump straight to a PhD at that level. I thought, well, with those experiences they had, I got interested in doing a charity work around them to see how I could support them on my own within the community. So I had I formed a drop-in center just for women of Black ethnic minority group women, not just asylum seekers or refugees. Like you can see, I'm a migrant. I wasn't born here. I came here so many years ago. So I became interested because being a migrant and coming across women like that in practice, I thought, well, we could do more than that. I could get to the bottom of why they were feeling uncomfortable or why they had those experiences, negative experiences that they were telling me about. So I started working in the community with them. So it was at that point, and now one of my lecturers for public health now contacted me to say, Tina, you are doing so much within the community. Why don't you take this beyond just having a master's? You could do well investigating this group of people by doing a PhD. I said, well, I don't have money for PhD. And so he gave me the link, the website jobs.uk, a website to say, go and check, you might find some funders there that could support you with doing a PhD. And that was how I came across the ESRC. They had advertised that they wanted for a particular kind of research, and their requirement was you get a supervisor first. If your supervisors are happy to supervise whatever research you have, they will be ready to sponsor you if you go through the criteria that they had lined up. And I thought, well, I wasn't sure that they would give me the funding. That's like many of us think. I just said, okay, it's an opportunity. Let me just send my application in. So I sent my application to Newcastle University, and I the supervisors I chose, I told them there was a funding application from ESRC. Let's see if we can work together and apply for that. And they said, yeah, where did you come across it? I said, I showed them the link and we went through the requirement. I said, well, I'm not sure they will give me because it's not, well, just apply for it and see how it goes. And that was how I got into, I was fortunate enough. I didn't get it at first. Mm-hmm. They sent me a letter to say, oh, we've seen your application, but unfortunately on this occasion, we won't, you are not qualified. I said, well, I'm not surprised. I would have been surprised if they said, congratulations. And they said, well, we've put your name down on the waiting list and we'll get in touch with you if there's a vacancy. And within 1 month of getting that response, I got another response to say, oh, congratulations this time. You now have a spot. And so that's how I got into starting my PhD.
And I find it really interesting because like it seems like you were lucky in finding all this information, but for, you know, other students to sort of, you know, go online and then, you know, see that there's a call for these scholarships. And it just seems to be that there's not a lot of proactive, you know, trying to get students really excited about this, because it seems the research you're doing is really exciting, right? Like you're looking at a tangible problem that you saw from your particular perspective, which other students or other candidates might not see. And then you were able to find a funder who knew how important this was, you know, that women were having these really sort of unfortunate and negative experiences in their pregnancies, and then trying to formulate research that fits within the parameters of academia. You know, like you're doing all of these things, and like, what would you sort of say to students who are considering it, but maybe have an idea that they think, you know, this is not going to get funded?
For me to get the funding and for me to be where I am now, I was very flexible. I was very, very flexible. I would say to students that are applying that want to do a PhD, that are interested in going further than having a master's degree, when you come across opportunities like this, don't say, oh, no, they won't give me that, because what ESRC wanted wasn't exactly what I applied for. I just thought, well, what they wanted was in social sciences, which is where I am. And we looked at it. I said to my supervisor, I said, this is a real problem that I'm handling. And I think if we put this real problem, if we put the proposal before them, I mean, there should be women in the panel there. When they see these problems that we are talking about, I'm sure they will consider it. And I remember one of them was like, but that is not what they want. I said, yeah, just put it forward. It's not going to cost us anything. Mm-hmm. So I think I was just being persistent and resilient in what I didn't want to give up. I said, you know what, put it up, because anything that has to do with human being, it doesn't matter if you are black, white. I mean, you might be British today and you go to America, you become an immigrant there. So I just said, put it up. So I'll tell students that are thinking of going into academia, don't let anything stop you. If you have a vision, if you have a dream, especially with the ESRC, the kind of research they fund, you'll be very surprised. It's just like I did. I went searching for them. If you are interested in something, you don't just sit down and the thing comes to you. It doesn't come to you like that. You have to go. I went searching night and day. I was on the internet every day. I kept looking at everything they wanted. Before I saw their first advert that was published, I didn't know anything about ESRC before. So when I saw that, I was like, economic, okay, this might be good for me. I'll just see how I can tweak it around to suit them and suit me. So I would say to students, don't give up. Just give it a try. And don't think because you are who you are, they might not listen to you. Because some of us, we have everybody has different area of interest. So whatever your interest is might not be what my interest is. But because of the kind of funders that the ESRC, the NINE DTP is, you might be very lucky. As long as your research is around their parameter, I'm sure somebody will consider it. It has nothing to do with your color. It's about what you put out there. And that's all I have to say about that.
And you were saying that you had support from some members of staff, some professors who really helped you. Could you talk a little bit about that in terms of mentorship?
When I'll say the journey to for me to get to where I am today would not have been possible without my supervisors. My supervisors, even before they became my official supervisors, they were like my guardians, you understand? Because I'm a professional, healthcare professional. I've never really been into academia. Every time I go to do a degree, I pull back to the wards because I like my bedside practice. I like to talk to people. I like to talk to women. I like the deliveries. I like that part of it. So I wasn't sure for a very long time what I wanted to do. I kept going back. After my first degree, I went back. Second degree, I went back. Another master's, I went back. Until somebody said, why don't you stop, Tina? Pursue this thing and see, you could use research to help people. You don't have to keep going backward and forward. And when I presented my thoughts, my proposal to my supervisors, they are now my supervisors, then they were like guardians to me. They were all very interested. I never knew them before. They are not blacks to be, for you. I mean, they are not from Africa. I'm not sure they've ever been to Africa. They are not black. They didn't see my color. They were not interested in my color. They were not interested in how I look, or they were just interested in the thoughts, the research I brought before them. And they worked with me all the way. Like the methodology I'm using now, I didn't know what it was all about. They brought everything and said, look, this will be better for this. They were my guardians, they were my mentor. And to date, till date, I would have been lost without them. So in everywhere we go, we need people like that to support us. And if you don't have a problem, if you don't present anything before people, how will you get somebody to support you? You won't. Nobody's going to come into meet you in your house to say, right, I think you are black or you are from this. I want to. No, you have to go out there. Maybe I was lucky, but my supervisors were they are my supervisors now. During the process of my writing my proposal, they were 100% behind me. I kept going into Newcastle University like 2-3 times every week. They gave me a space, a working space. I will write my draft. They said, send us your draft every time. So I'll send them draft of this is what I think I should do. They will come, it will come back with all red. You know what it is when you find red everywhere. And in between this, I was working, and they will say, it got to a point, they were even looking for funding for me to be coming into university to engage in other area of research. One of them, my primary supervisor now, actually came with me to my trust, Sunderland Royal Hospital, to seek for funding because I was working there and I was worried because I'm thinking, I was spending so much time with them at Newcastle University without pay, and they were concerned. I wasn't worried. I was happy to just have people to look after me, but they were not bothered at all. My primary supervisor traveled all the way from Newcastle University, came to me here. I had to wait for her at the train station, drove her to the hospital to see the research department at the hospital here. So say, right, Tina has been doing research with us. We know her a lot, and we want you to support her with some funding so that she can actually be like a member of staff within the university. But to the loss of those at the hospital here, they were like, yes, we are ready to support them, and we are ready to support her. But they wanted me to, for a price, so they wanted me to carry out an ethnographic study for them with my own research that I'm doing now, carry out an ethnographic study for a very minimal pay. Minimal pay if I wanted them to support me. And my supervisor said, no, they are just using you. You do all this research and they will take the credit at the end of the day. No, she said to them, thank you very much for your time, but Tina is not doing that. We will support her and we'll help her get funding for her PhD. So you see, those ones were fighting my battle, even though I am black, so I'm not white. So I don't think you should look at your color when you are thinking of things of academia. It has to do with what you want, your area of interest, and I think that's it really.
Yeah, and I was interested also, you were talking about And I think like even the listeners would be interested in knowing a little bit more about the kind of research, like the methods you're using, because I often find that, you know, they think that the funding bodies are really only going to take sort of conventional research projects. And you're really interesting and really important. So maybe speak a little bit more about kind of the research you are doing and the methods that you're using and how they're sort of different from what, you know, people might expect.
My research is not straightforward like other PhDs. I must say that from now. I have learned so much. I've spent 3 years at the university and I've learned so much in those 3 years. I have been able to carry out, for the first time, I heard about what they call systematic review of systematic reviews. I started with that in my first year, and over half of the people that were in my department they didn't have a clue of what I was talking about. And to be honest with you, for a very long time, I was equally confused. When my supervisor said, "Oh, Tina, I think we have to take your systematic review to another level. Let's do a systematic review of systematic review." I said, "Okay, what does that mean?" So I did that, and that paper has been published now, looking at the perinatal health outcomes of women with the status of asylum seekers and refugee. And after that, we went beyond that to carry out a primary quantitative systematic review. The outcomes I found out was kind of the adverse outcome that I picked out from my systematic review of systematic review. I had gone further to work on that, and I've done, like, thank God for the funding opportunity. I've been able to carry out a quantitative systematic review, looking at those outcomes that we thought were kind of causing problems for women with the status of asylum seeker and refugee. So we went beyond that to do that. And then with ESROC, they don't just fund like the conventional kind of research you're talking about. My research is actually meant to be an advanced quantitative research, not just ordinary quantitative research. But unfortunately, because of the COVID, we've had to like step down on everything. Most of the trainings I was supposed to go for to enable me carry out the final part of my research, which is where I am now, I've been unable to do them. So most of the materials I've been reading them online, reading books, teaching myself. So I've not been able to do it as advanced as I would have done, but I'm still doing quantitative research. I was fortunate before this whole thing to get a longitudinal data set from Australia that has been on for so many years. So now, after my 2 systematic reviews, I'm trying to compare the perinatal outcomes of women that are in Australia. I'm trying to do like, not just within, I'm trying to be specific. Australia and the United Kingdom, they have kind of similar healthcare system. Where when I say similar, for asylum seekers and refugees, the healthcare system is free, so they don't pay anything. And here, they don't pay anything as well. So I'm trying to see if the health outcomes of women that are there and the health outcome of women that are here, I'm trying to see if there's any difference. So if there's any difference, our intention is to see if we can make it known to, for policy, to see if the government can implement whatever they are doing in other countries that is making them have positive outcomes, to see if we can implement it in our policies here in the United Kingdom. So, I mean, you can take your research to anywhere. That's what ESROC is there for. They fund you, they give you money. I mean, as long as when you want money for those kind of research, like I said from the beginning, you might start a research, like every research, you have your vision, but midway into the research, you find out that, oh, it's not as we thought, this is how it's going. And they have a pot of money for students to always, that they give you if they think you actually want to carry out a research that will benefit whatever PhD you are doing. Mm-hmm. So.
Yeah, and it's interesting, you know, you sort of found or searched for a problem that you saw, and you sort of developed this, and an interest that you have, it's passion that you have as well, and then you've sort of developed this research around it, which then, you know, now can potentially create social change. Because if you do find that, okay, policy X is working better here than here, you can sort of push to make those changes. And I think that a lot of students who are considering PhD work sort of think, okay, well, what am I going to do, or what is it going to affect, or what kind of impact is it going to make? And I think here you are actually looking at improving the lives of marginalized groups. And there are, you know, so many, and I'm watching all of these undergraduate students and high school students go out and protest, and they're activists, and they're so smart. And, you know, do you sort of think that, you know, those could be the future scholars that could engage in this kind of work if they just sort of knew about these programs?
I think so. I don't think they need to go outside to carry, I mean, they have their own reasons. But for me, I think there are so many ways you can communicate to the government, to people, through, if you have opportunity like the NINE DTP would give to you if you apply for funding. When we talk about impact, the impact, the changing policies is what I intend. If I find anything at the end of the day, will be my ultimate goal, to see if I can bring out findings from this research to say, this is what I found out, and this is how it was conducted. And I think the government should implement those changes. Saying that, I work with many of those activist groups within United Kingdom, like Maternity Action Group. There are so many of them. I work very closely with the British Refugee Council. And in my first year, when I started my PhD, thank God for NINE DTP, I used them as a platform to organize a program here in Sunderland that attracted people from all over, from London, Manchester, all over United Kingdom. What I was trying to do, you know, the charity I said I set up at first before I started the program, I had women that were asylum seekers and refugees. And because I was doing this research, thanks to ESROC at Newcastle University, I had my supervisors behind me. I had the media department at the university behind me. I had everybody that could support me in my department supported me. And we organized like a very big event. We had the mayor, we had Maurice Wren. Maurice Wren was the chairman or president of Refugee Council, came all the way from London. And we had asylum seekers at the venue. We had the refugees that were from my charity group at the venue. They came to we had BBC, Newcastle, BBC here. They came, they were on telly, they were everywhere. They were telling the people how, thanks to ESROC, because without ESROC, I won't have that platform. It's not just doing a charity from the community now, it's charity from an academic perspective. So with my supervisors, with my colleagues from Newcastle University and people from the community, I was able to present some of the asylum seekers that we had made changes to their lives. They came to testify that since I started this research, I'll come back to them to say, this is what I have seen. And to the local council here, I was very active with them there. I kept telling the local council that this is what they are doing in other places. I think asylum seekers and refugees within Sunderland should be able to benefit from things like that. So when the mayor came, the mayor said, yes, several times she has seen letters from me in their office and all that. So it made headline for a long time. And from there, I won the Impact Award in 2017 or 2018, the NINE DTP Impact Award, because I presented what I have done. I presented so many things. And my picture was all over Newcastle University with the Vice Chancellor, everybody, to say thank you for the little thing I have done. So if that was just a small part of it, so if now, for instance, I have been able to complete my systematic review of systematic review, I've been able to do my primary systematic review, and I'm thinking of using a longitudinal data set, 2 of them, not 1, to compare outcomes of this less privileged, vulnerable people from United Kingdom and all over the world. If at the end of the day, we find anything negative, or we find anything, I mean, the papers will be published anyway, we find anything positive. My intention, thanks to ESROC, is to take it beyond Newcastle University and beyond Northeast of England to the House of Parliament to say, yes, I'm from Newcastle University, funded by this body, and this is my findings from my research, and I will want to see if it can be implemented and we can use that to change policy. So I cannot stop saying thank you to ESROC. I cannot stop saying thank you to NINE DTP. And I cannot stop telling people of color, or people from my background, or people from other background, minority group or whatever, that you have to go search for what you want. The reason why you have very few people in the NINE DTP group is because people like myself, people from my background, think those kind of opportunities are not meant for Black people, they are meant for white people, because they have this picture that if they go to the universities always think that academia, especially PGRO, is for those middle class, white, intelligent, smart, rich people. No, it is not. It is not. I'll say that any day, anytime. I'm not close to white. I'm not rich or anything. I'm from Africa. But you just grab the opportunity you have. You just, there's no point crying. There's no point saying they won't give me if you don't try. As long as you know what you want, just send out your application and just believe that it will work. It will work. It's not an easy journey coming for me. I mean, for the younger ones that are going through PhD, masters like that, it might be easy for them. But for people like us that I've been a midwife for nearly 20 years. So imagine speaking one language, then suddenly you find yourself, now you are now trying to talk among professors, you are not trying to talk among doctors, and you are Black. But I really don't care. My color does not determine who I am, you understand? So I feel I know what I want, and these people, like my people, the area I'm looking into, they are very vulnerable. They need a voice. If I have been opportune to be where I am, not many people of my color, or not many migrants, let me use the word, are opportune to be where I am today. So I think I should use the opportunity I have to speak for the less privileged. So that is what I'm trying to do.
And have you had a good experience with just meeting new people and new ideas and the training and all of that, just in terms of the opportunities that you've been given by the university, but also by like colleagues and staff and support and kind of interesting conferences and, you know, all of that other stuff that comes with being a PGR student?
Yeah, I would say with regards to that, I haven't been very fortunate because my research took a turn. In my first year and second year, I initially wanted to use the NHS database as my source of data. But to my greatest surprise, in the whole of United Kingdom, they don't have anywhere where they store data of the group I'm looking into. So I would say my second year was the most frustrating year. I wasn't thinking about conference. I just wanted this data. And I wrote to everybody you can think of in the United Kingdom, please give me data. Please let me ask. There was no data. There was no data. I tried Royal College of England, everybody so my second year was the most frustrating year. It has nothing to do with my funder. It has nothing to do with my university. It's just the way the country is. And somebody said to me, in fact, when I rang NHS England, they said, oh, asylum seekers and refugees are grouped together with women that have social complex problems. I said, what do you mean? I said, those are women that have problems with drinking and smoking. And she said, yes, we group them together as one. I said, but why would you do that? She said, well, I'm sorry, we don't have separate data for them. So if you are trying to get data from them, just use data of people with social complex problems. I said, no, that's wrong. There's no social complex problem there. They are just immigrants. They are just refugees there. So my second year was very frustrating. So my plan was, whatever I have done, in my third year, I will go for conferences just to tell the world what I found out. And all the conferences that was booked and everything ended up not, I ended up not being able to go. All I could do was send my papers to them and nothing happened. So that experience, I mean, ASROC will fund you, they will sponsor you, because most of my colleagues that are not, that were fortunate to have their data around, they went as far as Japan. Some of them went to America for months. They kept going backward and forward. They were all being funded by ESRC. My colleague, my PGRO colleague that we sit together in the office, she was in America. She was in the US like 2-3 times for presentation, paid for by ESRC. She came back, she was like, Tina, it was beautiful. I said, well, as soon as I get my data, I'm going to go. But I've not, this is me still here.
Yeah, I think that's something so many academics are dealing with, is with COVID and everything, and really trying to do their research in spite of this and all of the other, you know, academic things that they want to do. So maybe as a final few questions, maybe talk a little bit about what you want to do afterwards. Do you have a sense of like, you know, I know that people often think that, okay, after you get a PhD, you're just going to go into academia, which is what a lot of people do, but a lot of scholars decide to take different paths and do different kinds of research. Is there something that, you know, you're looking towards or hoping for?
I think my confusion of wandering into academia is still ongoing, because I sit down every day. It would be nice to just finish and just go into academia, sit behind the computer, do your research and all that. But I don't think that's who I am. I think the PhD journey is an eye-opener for me. It has kind of, it has created a very broad enlightenment for my thoughts and thinking. It's like, I think it has given me a voice. I think for me now, the PhD, the research is like a voice. I think just going into academia, I mean, if going into academia is fine, doing other things is fine, but I think I'll be better off pursuing things in the community, within the community, just to see how I can do more research and more research. But if I can, I really don't know. You can tell I'm confused, because I don't want to be stuck like I was as a nurse and midwife for so many years, thinking, oh, I'm just, because once you get stuck, you start enjoying it. But I think I would like to take it further. If I find out that, oh, this is an area where I think policies should change, government should change things, I would like to do more research in that area. You understand what I'm trying to say? I would like to do more research in that area to see how we can improve it further. And you know, from your experience, another research will come out of that. I think that's the kind of route I would like to go if I get any more funding, because it's expensive. But I think I'm enjoying it. I like it. I like reading it, and oh, this is what is happening. Okay, let me put it in writing. Let me publish it, because that is the only voice you have. That is the paper we publish. I mean, we published 2 papers now. I've been receiving emails. Nobody knew me before, but because of the findings of that research, everybody now, people that are interested in research around my area, around my field, they now know my name, and everybody's emailing me, can you get me this? What about this? Can we do this together? You know, I like things like that. And I think that's all you can actually give if you are opportune to be funded by people like the ESRC.
Yeah, and the collaboration can be really productive. A lot of students, I think, sometimes think that the PhD has to be a very isolating process, but it can be one that there's a lot of collaboration.
Yeah.
And yeah, you can kind of make your own journey afterwards, where you can do, you know, community engagement and activism and research, and maybe have an affiliation with a university if you didn't want to. Yeah, so there's all those types of things. And I also was hoping, as a sort of last question, to ask you whether there are any books or pieces of art or media that you think really changed your thinking in ways that fit into your research that you think was inspirational or pivotal? I know sometimes, you know, for me, you know, reading work on feminism and science, you know, like the Sandra Harding or the Donna Haraway kind of books and pieces of art that really look at science and gender, really, you know, I sort of felt myself going back to them a lot to give me inspiration for doing more work. Is there anything that you can remember that sort of propelled you in that direction?
I would say I like I like reading books, not just normal books. I like reading books that reminds me of who I am, where I'm coming from, and I like read. I listen to and I read things about things. I don't know. Martin Luther King is what every Black person would always tell you. Oh, I listen to him. I watch his videos, and I think there's one particular line that keeps sticking in my head every time I'm trying to do something, I'm going anywhere, where he was talking about something about injustice. Anywhere is a threat to justice. Everywhere. That we are caught up in this inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. So every time I'm sitting down, I'm fortunate to be here. I'm fortunate to be funded by the NINE DTP. But not many people of my color are like that. And that's why I said I like my community engagement a lot, because in the community, I come across many people that are very unfortunate, that are not fortunate to be in my position. Many of them are very intelligent, but they lack awareness. They lack mentorship. Because when you come in from whatever country into this country, you feel, some of them feel lost. Some of them think, no, those kind of jobs, those kind of PhDs it's for rich people. It's for people that are this. And you see them doing many jobs. You see them, they have qualification, but they don't have the guts, they don't have the confidence to approach places and people that they can approach. And take it or leave it, they are Black. And if you are describing a Black man on TV now to say this Black man did this, automatically I feel like you are talking to me, because like Martin Luther said, whatever affects one affects all. So I'm thinking, with books, with stories like that, I'm thinking if people like us can break out of that shell and say, no, PhD is not just for the white privileged one. You can have a PhD. And the PhD you have is not because you want to be a doctor. It's because you want to break that, that bound of where they say Black people cannot get there because of this, because they are Black. Because if you look at the number of the percentage of PGRs that are PhD students, I think I was looking at it about 16-point-something%. Very, very low. And you see most of them, they will tell you, nah, I'd rather go to work. Because the PhD journey will just tell you who you are. The supervisors will not work with you. Some of them will tell you the discrimination is very high, isolation is very high, marginalization is very high. Most people start PhD and they don't finish the PhD because of their experiences. So for me, I stand on with that word, whatever affects one affects all. So I encourage people of my color. I have a center here in Sunderland. Because of the COVID, I don't run the center anymore. Every Saturday I meet with people of color, the young ones, the youth, and I tell them, don't let anything stop you. I give them opportunity, a website. I tell them, they come in with their computers, we go through things that they could do. Blacks and the minority group, we don't have to be associated and affiliated with bad things. I will be very happy if I turn on my TV and I see that one of you is a professor tomorrow. And you cannot become a professor if you don't go to school, you know? So Martin Luther King is the only person I like his stories. I listen to him. I like his words of inspiration. And I just stick to that.
Yep. Oh, I thank you so much. That I think is a good place to leave it. So again, thank you so much for doing this. And I do hope that students who see this, you know, decide to apply. So thank you.
Yes, I hope so. I hope so. Let them be motivated. It's not for just white people. They have to search for it. You have to look for it. They won't come looking for you. If you want something, you go out and get it. Nobody's going to come knocking on your door. And you have to define what you want and search for what you want.
Yep. Okay, great.
Thank you. Thank you very much.